Thank you so much to everybody for joining us today. I hope you're having a great afternoon. This is the second learning session of the UHN Summer Training and Research Program, and today we're going to explore careers in research and healthcare. My name is Dr. Amanda Very, and I'm the lead of the Office of Research Trainees at UHN, and I run the summer program. I want to start by saying a big thank you to Dr. Jessica Hill from the Molecular Genetics Department at U of T for being with us today and providing support. But I also want to say thank you to everybody who's joined us. Like I said before, there's lots of people here with diverse backgrounds, and I hope you all find something useful and helpful. So let's get started. I just wanted to give an introduction first on the programs. The UHN Summer Training and Research Program, or STAR Program, is a series of learning sessions that aim to help build your research and professional skills outside of the lab. So we know you're getting amazing training inside of the lab, and we just want to add to that. So we're hosting a variety of sessions this summer, which are open to everyone, not just summer students at UHN, although we hope summer students at UHN enjoy it as well. Students who are from UHN this summer are encouraged to participate and can receive a certificate of program completion for attending or watching the recordings for at least 4 sessions and for participating in our research day. More information about the research day will be sent out and will be explained in one of the later sessions. If you haven't already, we highly encourage you to register for this series by using the QR code on this slide, and that'll give you reminders about all of the events and as well as the recordings. You only have to sign up once to receive all of them for the whole series. For UHN students, postdocs, and staff, I want to draw your attention to a really cool event that we're hosting on June 22nd. So this will be a scavenger hunt, which will have you teamed up with other people at UHN to explore UHN in Toronto. And you'll have to answer questions and take photos along the way with the Goose Chase app. This is something that should be super fun. We did it with the staff last year, and it was amazing. So we're doing it again this year with students and postdocs. We hope if you're part of Team UHN, you'll consider joining and register now using the QR code on the slide. Before we go any further, I want to acknowledge the land on which UHN operates. There has been a UHN hospital on this land since 1829. For thousands of years, it has been the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. We also acknowledge that Toronto is covered by Treaty 13 with Mississaugas of the Credit. This land is now home to many diverse First Nations, Inuit, and Métis people, and we are so grateful to have the opportunity to live and work here. I'd like to invite you to join me in taking a moment to reflect on the land that you are on. I'm reflecting on the opportunities that this land has provided to my family, as I come from a family who immigrated to Canada for a better life. I'm grateful that I've been able to live, train, and work here, and I enjoy the beauty of the land that Canada has to offer. With that, I also promise to continue to be on an endless journey to try to respect and cherish the land more and understand the people who came before us. Okay, now jumping into this session, I wanted to start with a few guidelines and tips. First off, and most importantly, please be respectful of others. This is a safe environment and a safe space, and we expect mutual respect to be given to all participants. We take that very seriously. Next, the slides and recordings for all of this presentation will be sent out tomorrow to all the registrants from Eventbrite. So if you want, just absorb all the information without worrying about taking feverish notes, because we'll send that all to you so you can review it again later. If you have any questions or concerns at any point in time, feel free to pop them into the chat, and I'll try to adjust what I can. And lastly, for UHN research summer students who want to receive the certificate of program completion, you'll be asked to fill out the attendance form at the end of the session. Great. So let's get started. Let's talk about some career exploration. So I want to start with a poll, and we'll do this just simply in the chat. I want to see where you're at in your career journey. So please share your answers in the chat. Do you A, know exactly what career you want to go into? B, you're debating between 2 to 3 career options, or C, you're exploring many career options. And there's no right or wrong place to be at this point. No judgment on your answer. We just want to see where you're at. I can say personally, when I was in undergrad, I had no idea what I wanted to do. I explored every single career option. And even after my PhD, it really was really difficult. There's lots of options, and yeah, so wherever you're at is great. So this is great. We're seeing a lot of B's and C's, some A's. So a good mix of people who are still openly exploring different options, which is fantastic. And I really hope today that I can introduce you to maybe some different opportunities you've never considered, or help you to explore some of the ones that you have considered a little bit further. Amazing. Okay, so first, I just want to say that the most important thing to understand is that career exploration and careers themselves are a journey. So whether you know what you want to be or what you want to do with your career or not, there will likely be many twists and turns and factors that might change your mind or guide you in different directions along the way. Lots of people think they have a clear idea of what they want to do, but then different opportunities come up or different obstacles come in their way, and that changes, and that's okay. We just ask that you embrace the journey. So today we hope to give you some factors to consider when picking a career, introduce you to some careers you may not have heard of, and give you some tools for how you can explore these careers a little bit more. So I'm going to start off first to consider what factors are important to you when you, sorry, one second. What factors are important to you when looking for a career? So there are many different factors to consider when evaluating whether a potential career is right for you or not. I'm going to give you a couple of the options of things that I consider and that people often consider, but there's tons of different factors. So the first one could be the length and nature of the training. Now, this is important because we know many different careers require different requirements and different training. And this can be affected by how many years of training it is. Some are much longer than others, and that could really make a difference to you. Whether that training is full-time or part-time, whether you'll be making money during your training, how long it will be until you start making money. And these are all factors that are really important to consider, and consider whether those factors affect your decision. Another factor is compensation. So compensation can include all of the things, including your salary, but not just your salary or wage. It's also your benefits, the perks of the position, and as well as your ability to be promoted or to receive increases in compensation in the future. And again, these are important factors because it will affect every part of your life. Is these compensation factors and the benefits and things like that. It will affect how you can have kids and where you can afford to live and things like that. So very important to consider. Next is the working hours. So this can include factors like how many hours you're expected to work a week, as well as what dates and times. So for some career options, you might need to have to work shift work. You might have to be on call all the time, or you might have to work 60 hours a week or even more. And that can affect your lifestyle and your happiness. So it's something to consider. Pension is a great one too. Yes, Dr. Hill. Next place is workplace culture or values. And this can be a lot of different things to a lot of people, but some of the examples are if you want to work for a big company or a small one, if you want to work for a private company or something that's public or not-for-profit. Is it important to you if there are certain things that are mentioned in the company's mission or the way that they structure their company? So those can all take part. Some people also care about how the position is perceived by others and whether it's respected or prestigious, and this can be affected by whatever circle you're in or whatever culture you're part of. Another one is the nature of the day-to-day activities. So a career might sound really interesting to you in principle, but you need to know what they do on a day-to-day basis. So a lot of people are surprised by the amount of administrative work that a lot of roles have. You also want to consider whether the day-to-day tasks are very stressful in nature, are they very technical in nature, or do you work on independently a lot, or will you be working on a team? You have to think about whether those activities fit in the style of your learning and your happiness. And the last one that I'm going to mention is location. So this can include preferences about whether you want to work from home, on-site, or hybrid, but it can also include the actual location. So some medical professionals, like heart surgeons, are only located in big cities, which might not work for you if you want to live in a small town. Or many jobs like PI positions are very competitive, and so they might require you to be really flexible in your location, especially at different stages of the training. You might have to change locations often. So these are just some of the things to consider, but it's important for you to reflect on those factors and decide which ones are most important to you, because you may have to make compromises places, but if you know which factors are the most important to you, then you can really decide which career paths are important or are conducive to your lifestyle. So for example, for me, location was very important. I wanted to stay in Toronto and be close to my family. So some opportunities weren't available to me. I also find working hours and culture very important because I would prefer a 9-to-5 job, and that's the lifestyle that I wanted. And so these are just kind of things to think about, because if I want to work a 9-to-5 job, then I can't necessarily be, a neurosurgeon who's always on call and has to be in surgery. So just something to consider. So I'll take a second here to pause and would ask you to drop in the chat what factors are important to you when making these decisions about careers and when analyzing these different kinds of careers. Compensation is a very popular one. Culture, values, great. If there's anything that I missed, definitely include those as well. Appreciation, vibes is a great point too. Flexibility, impact on society. These are some great answers, and all of these things are really important. Longevity of career is a great point too. Being in a place where you can see that you'll have opportunity for growth is very important. Awesome. So continue to drop those in the chat if you have them, but we're going to move on. So I'm going to jump into some of the career options in research. So I want to present to you some of the hundreds of different roles that are in the hospital and research settings, just to kind of get you started. And while working in the lab this summer, you might encounter people in these roles or meet other people in different roles that I didn't mention, which is great. And one of my absolute favorite things about working at UHN is a strong intersection between healthcare and research. So there are so many scientists, as well as grad students and postdocs, who are also trained as medical professionals, and they have really interesting careers and really interesting plans for the future. So you can learn so much by talking to these people and talking to them about their experiences. You also might also collaborate with different kinds of research professionals. So take in that experience and meet people and learn about their careers, and it might help you with your career exploration as well. Another option, if you want to learn more about the positions I talk about today or the kinds that would be available, I highly recommend that you take a look at the job boards at places like UHN or as well as the universities. And while you might not be looking for jobs right now, I like to use this as a tool to understand what kind of jobs exist in these spaces, and then use the job descriptions to give you an understanding of what the job does, what kind of requirements they usually have, and that'll kind of help you to understand whether it's something that you think you could like and you would want to work towards. So hopping into the careers, I'm going to start off first with research technicians. So these are research staff working in a lab performing experiments under the direction of scientists or other staff. Now, this is a super broad category. It includes many different kinds of positions in many different areas of research, but the main defining features are that they are staff who have bachelor's or master's degree in science, and they are working in research in a lab. And so you might encounter many of these while you're doing research. They could be people who specialize in taking care of certain equipment, the animal facilities, or people who do research right along the bench with you. They could be people who take care of the lab and help with ordering and things like that. There's a diverse amount of different responsibilities and roles that fit into this. Next, we have research or scientific associates, and these titles and descriptions can be slightly different depending on the place. I know they're different between UHN and U of T, so just something to keep in mind of. At UHN, these are PhD level scientists who design, plan, organize, and carry out research projects. So like the research technicians, associates can also have very diverse responsibilities, but that includes things like serving as consultants, supervising staff and trainees, publishing papers, doing their own research, and much, much more. Now, the main distinction, because those just definitions are pretty similar, the main distinction between technicians and research associates are that they have completed their PhDs, and so they're often working independently on research projects. And that can also mean that they're working on larger projects, maybe collaborative projects. They might be more complex, and they basically have more responsibilities that come in line with that PhD. Next, we move a little bit outside of the lab to clinical or clinical research analysts or coordinators. At UHN, we have tons of these. So analysts, assistants, and coordinators who all work in clinical research. And the roles are to facilitate clinical research involving human participants. So the responsibilities in these roles definitely are diverse. There's so many different clinical research roles and different projects that they support, which changes kind of what the job would involve. But some of the responsibilities can include recruiting study patients, collecting their information consent, coordinating the visits of the participants, interacting with the participants, collecting data, developing protocols, and much, much more. So these are really cool positions because they're doing research, but more on the clinical side. There are many different levels of clinical research positions, including, as I mentioned, assistants, analysts, and then coordinators, and then many stages of coordinators. But at minimum, they usually require a bachelor's degree. As you move up, they can also require additional work experience, master's degrees, or a certification in clinical research. And then again, these things could be important if you want to get promoted or hired into more senior positions. So the certification in clinical research is something you can definitely look into if you're interested in careers in clinical research, as it'll give you kind of the foundations that you need as well as that certification. I'll also mention that there are other positions within this space, like clinical research managers, regulatory people, and much, much more. This is just kind of a taste. So next we have scientists or principal investigators. And if you're a summer student, you likely have one of these as your boss. They are scientists who lead their own research groups or labs. They have lots of different responsibilities to run those labs, including providing leadership and management, securing and managing funding, which is what they do a lot because labs need a lot of money to run, designing and managing research projects, and basically overseeing everything going on in the lab. So these lab positions are very highly competitive. They require a PhD degree, and in many different fields, they also require experience as a postdoctoral researcher. That's not always the case, as in some fields like engineering, you can go straight from your PhD to a faculty position, but it depends on the field and the institution. On a related note, next we have clinician scientists, which are also sometimes known as physician scientists. And these are scientists who have both medical and research training. So like scientists, they run scientific research labs, but they also have clinical practices at the same time. And the amount that they spend or contribute to their research versus their clinical practice varies. But these investigators often play really critical roles in clinical research, as their clinical practices influence their research, often working on highly translatable research projects that can help specific patient groups that they specialize in helping in the clinics. So there are two main routes for clinician scientists. One is to do a joint MD PhD program where you do both of the degrees combined. And the other route is to do a clinician investigator program that can be done after your MD degree. So those are the two main routes I would suggest, but basically it involves having an MD as well as having that research experience from the PhD. Very intense training. Okay, so of course, these are only a snapshot of the research positions. There's also tons of other ones. I've put some of them on the slide here. You have people like research analysts that are involved in data management, or as well as data analysts. You have bioinformatics analysts and biostatisticians, software developers, and basically all of those people who do things, different kinds of analyses and prepare different things that you might need for your research or that can help contribute to the research. You also have project coordinators who are responsible for coordinating all the different aspects of research projects. You can have bioethicists that advise on the ethics of different research protocols and practices, as well as the category which is called research support services. This is a huge category of different people. My job falls under this category of people who work to support research. And I love these jobs. My job, of course, is to help support research training and career development, which I love. But there are also other people in this group, including people who are communication specialists, who communicate the research that's happening, policy developers and analysts, grant writers, finance professionals, managers, strategists. Research strategists is a really cool position as well. and much, much more. So if you're not necessarily interested in doing the research yourself, but you love being in the research space, I highly recommend checking out these research support services positions. Okay, so now we're going to shift gears to careers in healthcare. Yes, Dr. Hill also mentioned teaching stream faculty, like their position, which is great. So now we're going to shift gears to careers in healthcare. There's so many different careers that fall into this category. It's actually unbelievable. So I can only give you a small taste of some of the positions you might be interested in. I put on here 2 QR codes for 2 websites that I really highly recommend that you explore. They have really good lists of different kinds of careers in healthcare and resources on each career. The Mayo Clinic's website has a really good resource where you can sort by different factors like salary or training or things like that, which makes it really easy and digestible to go through them. I really like databases like this because you can find a lot of information in one place. It's easy to navigate, but you can also easily compare them. So a lot of the information that I'm going to share with you about these next careers come from those websites. So I highly recommend checking them out. Okay, so we're going to start first with speech language pathologists. And these are medical professionals who diagnose and treat a wide range of speech, language, cognitive, and swallowing disorders. So they work with patients affected by a variety of different conditions, such as neurological events, such as brain damage, stroke, seizure, cancer, lots of different kinds of conditions that people can have. Their job is to create treatment plans that are tailored to the patient's needs. And what's really cool about these is they can work in a variety of different settings, including working in the hospital, but also work in educational settings like schools to help students with these kinds of conditions. And so the training for this includes a 2-year graduate program, but following that, there can also be additional fellowships and certifications that are required. And really cool, I've met postdocs at UHN who are speech language pathologists that continued on to do research as postdocs. And they integrate that medical aspect to their research, which is really great. Okay, next we have genetic counselors. So genetic counselors have a big job of using genetic testing and family history to assess the risk of an inherited condition, such as a genetic disorder or a birth defect. With that, they're also involved not just testing these patients and identifying them, they also work to educate patients and as well as medical professionals about genetic diseases and the testing. They advise on the social and ethical issues involved, and they also help patients to cope with the diagnosis of genetic diseases. Now, the training for this program is a 2-year Master's of Science in Genetic Counseling program. So it's a specific master's program specifically for genetic counseling. And these genetic counselors can work in a variety of different settings as well, including working in hospitals or working in private settings. Next up, we have cardiovascular perfusionist. And this one I like to throw in because it's something that I think that maybe not everybody has heard about before, because I was definitely shocked when I heard about it. So their cardiovascular perfusionists are in-demand roles, and they're individuals who play a critical role in the operating room. So they are responsible for operating equipment such as a heart-lung machine, which temporarily does the job of the heart to circulate fluids during procedures such as an open heart surgery. Well, I'll let that sink in for a second, but basically the perfusionist is involved in making sure that the heart works properly during surgery, which is such an intense and such a cool job. So they monitor the patient's vitals and select the appropriate equipment and technique to manage normal blood flow, body temperature, and other respiratory functions. So they work very well with other medical professionals during these surgeries and procedures. Now, there's a 2-year training for this that is a master's program. The only place in Canada you can complete it is at the Michener Institute, which is affiliated with UHN. And Michener has great videos on their website of cardiovascular perfusionists in action in the OR. So if you want to check that out, definitely watch them. It can provide you a good snapshot of kind of what the function is and how it would work. Next up, we have occupational therapists. So these are medical professionals who work with patients who have conditions that are mentally, physically, developmentally, or emotionally debilitating. And they help these patients to develop, recover, or maintain the skills needed for daily living and working. So for example, somebody who has a who has a condition like multiple sclerosis might work with an occupational therapist throughout the course of their disease progression to help them to adjust to the skills and the things that they need to do on a daily basis. These occupational therapists plan treatment programs, perform task and activity modification training, and help patients to use adaptive equipment. So there is a master's degree in occupational therapy that you'd have to take to become an occupational therapist. Okay, next we have a recreational therapist. This is something I've only heard about recently, and I think is so cool for people who have a passion for arts or sports or any of those other kinds of things in their life and as their hobbies, that they can take them and incorporate them into a career. So here, recreational therapists use creative healing methods to help people with illnesses or disabilities to become active again or maximize their health. This maximizes their independence and improves the quality of their life. They do this by utilizing arts and crafts, animals, sports, games, dance and movement, drama, music, and community outings to help patients to maintain or improve their physical or mental health. So I think that's such a cool position. The training for this can vary. It requires usually a bachelor's degree. There are all the requirements for working experience or internship experience, as well as there's a certification you can do as well. Next, we have a physician assistant. So a physician assistant is somebody who works with patients of all ages in virtually all specialty and primary care areas. And they diagnose and treat common illnesses and work with minor procedures. So basically, they're providing direct patient care. So they can assist in surgery, they can order and interpret tests, they can prescribe medications, and lots more. So what's really cool about this is they have lots of responsibilities that are similar to what a physician can do, but they're actually a different role as a physician assistant, and the training is substantially different. So they have a 2-year physician's assistant training program that you do after your bachelor's degree. And again, these professionals work independently in healthcare settings, but they also work in collaboration with supervising physicians. Next up, we have a similar role, which is a nurse practitioner. This is a registered nurse with advanced training in administering patient care. So they're qualified to meet the majority of patients' healthcare needs. So they can examine patients and diagnose and treat illnesses. They can interpret lab results and x-rays. They can prescribe medications and provide health teaching and counseling to support the overall wellness of the patients. Now, these nurse practitioners play very important roles, especially in areas where there aren't enough physicians to help the population. So these nurse practitioners have a huge role because they're able to do so much of the patient care that is required. For this training, you require a bachelor's degree in nursing to begin with, and then as well as years of experience, and then you can do a master's of primary health care nurse practitioner. Next up, we have a cytotechnologist. I apologize, I spelled that wrong. But a cytotechnologist can perform microscopic studies on patients' body cells to detect cancer, viral and bacterial infections, and other abnormal conditions. So they're trained to notice subtle changes in the look of cells to accurately detect precancerous, malignant, and infectious conditions. So an example of this that you might be familiar with is Pap smears that are done to detect cervical cancers. So the cytotechnologists would be the one that are looking in the microscope to see whether the cells appear to have any differences that might suggest that they are precancerous or malignant. And these cytotechnologists work with other professionals like pathologists to make sure that the patients are then able to get a timely diagnosis. Now, this training involves, again, there's lots of different routes that you can take, but there is a diagnostic cytology diploma program that you can take from Michener, and you can do this after your bachelor's degree. Now, there's lots of, I've already mentioned 2 of the programs that Michener offers, but there's lots of other programs that they offer. Michener is a educational center that is associated with UHN that has lots of different training programs for healthcare professionals. So if you want to go into healthcare, but you don't necessarily want to be a doctor, I would definitely check out Michener because they have lots of different options where they offer lots of training for different positions that might be cool. And I've learned about a lot of cool positions that I didn't know existed by looking at what my Michener offers. Of course, those were only a snapshot. There are tons out there. And if you explore those 2 websites I shared, you'll be able to see a lot more. Some of the other examples are things like massage therapists, as well as physiotherapists, respiratory therapists, radiation technologists, orthopedists, sonographers, dietitians, medical physicists, social workers, midwives, phlebotomy technicians, optometrists, and lots more. And of course, I didn't mention things like doctors, dentists, or nurses, or optometrists. Oh, I did mention optometrists, but there's lots of other healthcare careers as well. I just wanted to kind of present you with some of the options that you maybe not have heard of. So I hope that I did that, and I hope you can explore some of these more. So the last thing I want to say is just to reiterate that career exploration and careers are a journey, and your futures will have limitless potential. And they can put that towards something that is one of these careers, maybe many of them at different stages of your life, or even one of the careers I haven't mentioned, or maybe even a career that doesn't exist yet. So just try to enjoy the journey. Don't stress out too much about figuring out exactly what you want to do if you don't know yet. There isn't really one right path to take. A lot of professionals, medical professionals, take different paths and they go through different careers before coming there. There's never too late to change paths. You can also go into research first and then go into medical professions. You can do medical professions first and then go into research. You always have options. So don't feel like there's never just one path you can take. There are lots of amazing paths that you can take instead. So keep your eyes open to meeting more people and learning about more careers, especially this summer as you're doing research at UHN or at other places or wherever you are. Just talk to people and you'll be able to learn more about their careers. And you never know, like I said, if the graduate student beside you is actually a physiotherapist as well and has a clinical practice. And so you can learn about their careers that way. No matter what, you'll find a great path. So we'll pause there. That is the content of this workshop. I just want to check in and see how useful did you find this workshop? Please give us a rating in the chat, 1 to 5. And in particular, if you have particular careers that you found really interesting to learn about that you hadn't heard about, please pop those into the chat as well. I'd love to hear which ones you're interested in, which ones you'd like to hear more about. If you've decided to maybe look into something a little bit more because of this, I'd love to hear that. And I'm always open to extending these discussions. So definitely let me know. So we'll give a second for that. I saw that there was a question in the chat that Dr. Hill answered, but I will take a stab at it. What's the difference between the role of a PA and NP?
Nurse practitioner and physician's assistant.
Okay, thank you. That makes sense because they were right beside each other too. Yeah, I would say that they're very different in terms of the training. So I think while the roles might seem very similar, the training is completely different. So nurse practitioners have a role that's more related to nursing. Their path is through nursing to get to that place where they can do those similar tasks. I think the settings that they work in could also be different, whereas a physician's assistant work closely with a physician and they're usually in the hospital setting. Nurse practitioners can work on their own in their own clinics. And like I said, they often work in remote areas, like small towns where there aren't doctors. So I would say, yeah, that's probably the main differences is the training as well as the environments that they work in, more independent versus in a clinic setting. And yeah, as Jessica said, you might have like different specialists that you work with or different specialty areas as well. But again, I'm not entirely sure. These things can vary, I'm sure, a lot in different places. Awesome. Okay, so if you're part of UHN research and you'd like to receive a certificate of completion, please complete the attendance form that's on the QR code here. So I'll give you a couple of seconds to do that. I can also pop the link in the chat. And again, the certificate of program completion is only available to students that are working at UHN for the summer. Anybody else have any questions? We have some time. Feel free to pop them into the chat. If you've registered before you got your ID, just shoot me an email with the information and I will update it. No problem. You have to attend 4 learning sessions, either live or watch the recording to receive the certificate, as well as participating in the research day. Students who are volunteering at a UHN lab are absolutely welcome to join the program and get their certificate of program completion. It doesn't matter if you have any UHN email, just on the when you're registering, just indicate your supervisor and the institute that you work at, will know that you're at UHN. To confirm the attendance, complete the form that I popped into the chat or that's on the QR code shown here. If you can't attend a session live, you can also watch the recordings, and then there's a separate form you can complete for that. Ooh, I love this question. So what is the greatest tip for student researchers at UHN who want to get the most out of being at UHN in terms of career exploring? I love this question because I think it's all up to what you make out of it. So if you're really interested in exploring careers, you can really take your time during the summer to meet with as many people as possible. You can do informational interviews, and these are just short chats that you can ask different professionals that you meet in meetings or that you look up. UHN has a fantastic directory. It's the 411 that's on the intranet. You can look up different career titles and find individuals and then contact them and just reach out with a short email asking if they would be willing to meet with you to talk about their career path and just tell them you're very excited in their career and you have questions. And they might be willing to take 15 or 30 minutes to talk to you and share about their careers. You know, a lot of people, if they have the time, are always willing to. And that can be a really good idea to understand whether you like that career path and when it fits you. I'll say when I was in undergrad, I explored cardiac perfusionist job for a short period of time. I thought it sounded so cool. And so I did an informational interview with somebody who was a cardiac perfusionist and realized it did not fit with my personality at all because the job is very stressful because you're the person keeping the person's heart going during surgery and you're working with surgeons and all this stuff. And that just, I wanted to work in a job that wasn't keeping the person alive. That was too much stress for me. So I think you can really learn a lot about some of these jobs and what the day-to-day is like and things like that by really talking to people. So I'd say if you want to get the most of your time at UHN, meet as many people as possible, ask them good questions, go to as many seminars as you can. There's so many cool seminars going on about different healthcare projects and things. And you'll really be able to get a taste of what's out there and all of the innovative things that are happening. And I think that can really help. You can also reach out to me, and I'm happy to have chats with anybody who's interested, and happy to provide more guidance. We have a question from Miriam about whether all UHN students will have the opportunity to present in person on August 3rd. And no, that is not the case. So what we do is everybody will be given an option to present their research in a virtual presentation. So these will be pre-recorded, kind of like 3-minute thesis talks where you'll have, 3 minutes to talk about what you learned this summer. So it's a really digestible, short talk about your research, and it's a wonderful format. And then from there, you'll be put into a competition, and we'll go through and we'll watch all of the videos, see all of the presentations, and they'll be scored by a panel of judges. And then the top presentations will be chosen, and those people with the top presentations will be invited to present in person on August 3rd. This is mostly just because of the size of UHN. There's so many summer students, so we really try to give everybody an opportunity to present, but then only some people will move forward to that second opportunity on August 3rd. But you just have to present the first presentation, the recorded one, to get the certificate of completion. You don't have to be, you don't have to present on August 3rd. Victoria's question, do you need to include your employee number? No, you don't. If you have one and you know it, please include it because it makes it easier for us to track all of your different forms, and when you check into different things, it's just an easier identifier than your name sometimes. But if you don't have it, that's fine. Awesome. So I just want to say thank you so much for coming. I really appreciate your attendance and all of the interactions that you've had in the chat. I want to tell you about our next session, which will be on June 15th. This will be about setting up for success and will be tips for new researchers. And this will be hosted by the UHN Library and Information Services. So definitely check that out. So again, it'll be June 15th. If you registered on Eventbrite, you will get all of the reminders for this. That will be great. There's another question about whether you'll get more criteria for the presentations and what to present. And yes, you will. All of that information will be given at the session about how to present your research. So we'll give all the information to you then so that you'll have plenty of time to prepare and submit your presentations. Amazing. So thank you very much, and we hope you have a great afternoon.